because Dr. Ryu Sang-hyo is here. Good morning.
Good morning. How are you?
I'm fine. How are you?
I'm doing great because my all bodies are aching because last week I talked about the muscle mass.
Yes.
It's closely linked to our brain. So I did pretty much workout. So
you did like leg day.
Yeah, leg day. And then my bodies are aching. So I tried to put it in a positive way. Yeah, okay. My muscle is trying to boost my brain power.
Oh, I like it. I like. And I'm sure you influence many people out there to think at least, do some leg workouts. But hey, it's Suneung Day today.
Okay. Suneung.
So we want an encouraging message.
You know what? I'm very expert. This is my right on my alley because I've done Suneung test 5 or 6 times.
And you know what? Look at you now. I know.
Okay. And also.
그러니까 정확하게 5번 보셨어요, 아니면 6번? 6번 보신 거예요.
On my 6th attempt, I got the college entrance. I passed it. And my 그 수능 내신 성적, what do you call it? 내신 성적 in English?
Your grades.
Academic grades.
Yes.
It's far below average.
Really?
Yeah.
But you aced the Suneung the 6th time around.
Yeah, that's right. And even my teacher, high school teacher, you want to be a doctor with this score? I never saw you got this score. You really just come to your sense. Okay.
그렇게 얘기했어요?
Yeah, that's what he said. I complained it to my mom, and then my mom was like this. Okay. You were kind of a not good student in your in your high school, and then you were your teacher was trying to teach you as much as he wants, but you couldn't follow him. And after 2 or 3 years, you show up again, and then you're gonna go to med school. Who would what would say to you when he didn't know any kind of efforts you put into that process?
Right.
So don't blame those things on him. Just you got to prove it by yourself. And also I could exactly remember when I went to the academic test장, center, and then with mom and my brother, and what kind of food we ate after that, and what kind of movie after we saw. It was a Bodyguard by Whitney Houston, Kevin Costner, and then and which seat it was I was located in. I exactly remember, and in front of me, I met a boy, and he got the top score in that in the test.
That year,
yes,
I see.
I remember. Even still, I dreaming of the test that I haven't prepared for. So I was waking up in the middle of the. I haven't prepared anything. I haven't prepared anything. Yes.
But hey, 6 time the charm for you.
Yes.
So thank you for your words of encouragement and inspiration. Here you are, Dr. Ryu, an expert on our show. So
thank you.
What are we diving into today?
Today is talking about vaccine.
Vaccines.
Yeah, because November is a vaccination season.
For things like what?
For things like flu vaccine.
That's right.
And shingles vaccine.
Shingles, 대상포진.
Yeah, 대상포진.
Yes.
And some of the vaccines like DTP. Diphtheria, tetanus,
and
pertussis.
Yes.
Diphtheria, 파상풍, 100일의 diphtheria.
It's so complicated in English or Korean, right?
Yeah. And some people who are afraid of getting shot, I would say the flu shot. How long has it been flu shot for human beings to protect our body?
I don't know. How long has it been?
Over 80 years. 80 years.
80 years since the first flu vaccine.
Yes.
Oh, okay.
So it's well proven. So,
Yes.
so there are many observational studies, which means scientists are looking over all those data and then what they're gonna be end up as they get older. One group doesn't have any flu shot. One group has flu shot.
Yes.
Which one comes with better results, things like that. Anyhow, recently we found that there's a strong connection between inflammation and our brain or vascular structure.
Oh.
Which means if you don't get vaccinated, it might put you a little bit high risk of getting stroke.
If you're not vaccinated.
Yeah.
Oh, really? Oh, okay. So another reason to get your flu vaccine, I guess. Yes.
Another reason is it lowers the chances of not only stroke but also depression. Yeah. Let me think. Let me put it this way.
Yes.
Think of our body is a nation, and then your body is surrounded by a lot of terrorists. The terrorists might be around your country. Some germs, some terrorist viruses are some other further away from them.
Okay.
Okay. So, which one is better for your country, for your body to wait till other terrorist attack comes to sneak into our body, and then you have to face a very painful, long standing war, or just bolstering or strengthening the border security and intelligence systems.
Okay.
And then when terrorist was about to attack, you were able to nipping it in the bud.
Yes.
Yes. Which one do you prefer?
Nipping it in the bud.
Yeah, that's right.
Meaning before your body's attacked, right?
And I say, yeah, that theory comes with our immune system as well. So whenever you experience some kind of inflammation, infection, whenever you have flu, you might experience some kind of a coughing, sneezing, and fever, headaches, at least 3 or 4 days. Yeah, it's kind of a minus when it comes to the productivity of your life.
Yes,
yeah.
yes.
And also these kind of chemical reactions, like a lot of cytokines, a lot of inflammatory markers, those things are released from our body and it travels all over our body, not only blood vessels and our brain. So our brain gets damaged with this kind of minor inflammation.
Okay.
Yeah.
So I want to go back to the whole stroke issue because you said that, if you are not vaccinated, then there's like a connection to stroke. Can you explain that?
Yeah, stroke can cause vascular inflammation. Vascular inflammation means your blood vessel is like a pipe or is like a supply chain. How can I describe this one? But without blood supply, every cell in our body would die.
Sure.
Yeah. Brain is one of the unique organs that's protected by blood-brain barrier.
Okay.
Which means brain is special. It doesn't take all those nutrients and chemicals. They don't let all those things into their brain. There's a strong filter, kind of a gate.
Okay.
Yeah. And that gate is going to be breached.
Ah.
And then also, and a lot of bad chemicals go into invade or try to sneak into our brain.
I see.
And it causes inflammation. So there are, even some people say that, stroke is just a stroke, but there are different kinds of stroke. Ischemic stroke.
Yes.
And also stroke is hemorrhagic stroke. It's inflammatory stroke, like due to inflammation.
Yes.
So I've seen those victims of stroke caused by inflammation. So vaccine can prevent this.
I see. Yeah. Okay. Thanks for explaining the connection between inflammation and vaccine and stroke. So, if we talk about shingles as well, because I want to get as much information out there as possible, 대상포진, there's a vaccine. Actually, I didn't know there was a vaccine until recently. Is this a newer vaccine?
Yeah, that's right. Yeah, before that, maybe the new vaccine was released about 6 years ago in 2020. Before that, we had a live attenuated vaccine. There are two different kinds of vaccine. The one is live attenuated vaccine, which means that it's a live vaccine. Okay. But their viruses are under a little bit. They were knocked out by some kind of mechanical or some manipulation. Sure. But they are the real virus.
It's a 생백신.
Yeah, 생백신. That's right. Live vaccine. The other one is antigen vaccine. But these days, scientists have developed new types of vaccine, which is a recombinant vaccine. Yeah, that prevents your lifelong shingle prevention rate is almost up to 97%.
97%.
Yeah.
And for those of you who have never experienced shingles, it is the most miserable thing that I had shingles. Several years back while I was on radio, I was working at BEFM and I was just overworking. My immune was really, really shoddy. And then I came down with shingles. That was so painful.
Catherine, I didn't know that you experienced shingles.
Right. And it was at such a young, I was in my 30s. And it was so painful.
Yeah.
It's so hard to describe.
What are the chances that you would experience again?
I don't know. Hopefully.
It's about 10%.
10% again?
Yeah.
Okay.
And also, the later you get it, the painful it gets.
Right.
And the longer it bothers in your life.
Sure.
So I would totally recommend shingles vaccination. And the issue is pricey, but pricey compared to the price you would pay in the States is pretty affordable here in Korea.
Yes.
And also shingles, there have been massive studies so far because shingles vaccination has been around over 6-7 years. So a recent Canadian study found that over 650,000 adults found that annual, it's not a shingle, but flu, when it comes to flu, it decreases 20% of risk of stroke.
Okay.
And also shingles, in the U.S. study, it lowers 10 to up to 20% lower risk of stroke and heart attack.
Oh, really?
Yeah.
Oh, so it's significant. It's not just like a small number, meaning like a very small percentage of people who don't get the vaccine might be affected by shingles or, and also the risk of stroke and all these things as well. So we have a question. I don't know if you can answer it from 태진님, who says, Dr. Liu, 독감이랑 코로나 두 개 동시에 걸릴 수 있나요?
Theoretically, I would say yes.
In theory,
In
yes.
theory, and you can get a flu shot. You can get a flu shot and COVID shot at the same time.
Right. Is it on opposite arms?
Opposite arms.
I'm assuming. I hope it's not on the same arm.
Yeah. But theoretically, it's possible. But I've never experienced the patients with this both
flu and COVID at the same time. But in theory, it's possible.
In theory, it's possible. As far as I know.
Yes. I've also read that. In theory, it is possible. So, wow. And if we had to add any more information, practical takeaways for our listeners today, what would you say to our listeners?
Okay, some people might be really, really reluctant to getting vaccinated. In that case, I would say they might have some kind of unsolved anxiety or fear. That stems from psychological point of view. It stems from confirmation bias. Confirmation bias is something unpleasant and something unsafe things happens nearby.
Right.
Your focus, your mental is focused geared towards that fact, regardless of all the data or regardless of the objective things. So whenever you are thinking, flu shot is very bad, I want you to look it up on the other side of the benefits. Okay, if you want to know the thing that you think is right, in order to make it seen from a very knowledge with logic, and best way to analyze this one is you have to look up other parts of that thing that's saying describing the same thing.
Right.
So I want to know this one, and also if you've been lucky and not getting any shots so far, hasn't been sick for a while, it means you've been driving your car without seatbelt fastened. So you have been lucky, but as we get older, as you try to try your car on the street, who knows when there's gonna kind of a car accident? Accident's not gonna be. Not always you're gonna be your fault. Some people just drug under the influence drivers might hit you.
Right.
Some unexpected things can happen. So I would say the always best is safety is best thing. So it's better to be safe than sorry. So my final message is a small vaccine today can prevent a big inflammation tomorrow. So small vaccine, can prevent much bigger, like stroke I mentioned, and also dementia I mentioned. Stroke.
Well.
Yeah.
Yes. Well, thanks for giving us such good information today and lots to think about, and your takeaway as well. We'll check in with you next week. Thank you, Dr. Liu.
Thank you.
All right.